Introduction to Chiropractic Therapy. Chiropractic therapy is a healthcare profession focused on the diagnosis, treatment, and prevention of musculoskeletal disorders, particularly those affecting the spine. It emphasizes the body's inherent ability to heal itself without the use of drugs or surgery. Practitioners, known as chiropractors, use a variety of non-invasive techniques to restore proper function and reduce pain. The core principle revolves around the idea that a properly functioning nervous system, free from interference, is essential for overall health. This discipline combines scientific understanding with a holistic approach to patient care, considering lifestyle and environmental factors. Its primary goal is to optimize health by addressing structural imbalances and nerve interference. Patients often seek chiropractic care for back pain, neck pain, headaches, and other joint-related issues. The scope of chiropractic practice extends beyond spinal adjustments to include a range of therapeutic modalities and patient education. Chiropractors often provide advice on exercise, nutrition, and ergonomic improvements to support long-term wellness. They work to empower patients to take an active role in their health journey, fostering self-care and preventive strategies. This holistic perspective aims to improve quality of life and prevent future health problems. Understanding the foundational concepts of chiropractic is crucial for anyone entering this rewarding field. It involves a deep commitment to patient well-being and continuous professional development. History and philosophy of chiropractic. The origins of chiropractic can be traced back to 1895, when Daniel David Palmer performed the first chiropractic adjustment. Palmer believed that misalignments of the spine, which he termed subluxations, interfered with nerve function and caused disease. He developed a system of manual adjustments to correct these subluxations, thereby restoring the body's natural healing capabilities. His initial work focused on a patient who had suffered hearing loss after a back injury, and after an adjustment, his hearing reportedly improved. This foundational event marked the beginning of a new healthcare profession. Palmer's early theories laid the groundwork for the philosophy that still guides chiropractic today, emphasizing the nervous system's central role in health. The initial school was established in Davenport, Iowa, attracting students eager to learn this new approach to health. The philosophy of chiropractic is rooted in vitalism, holism, and naturalism, asserting that the body possesses an innate intelligence capable of self-healing. It posits that health is a natural state, and disease results from interference with the body's normal physiological processes. The primary focus is on identifying and correcting spinal subluxations to remove nerve interference, allowing the body to function optimally. This approach considers the patient as a whole, integrating physical, mental, and social aspects of health. While the core philosophy remains, modern chiropractic has evolved to incorporate evidence-based practices and integrate with mainstream healthcare. It continues to emphasize a non-pharmacological and non-surgical approach to health and well-being, promoting a proactive lifestyle. Anatomy of the spine and nervous system. The human spine is a complex structure composed of 33 vertebrae, divided into 5 main regions: cervical, thoracic, lumbar, sacrum, and coccyx. Each vertebra is separated by intervertebral discs, which act as shock absorbers and allow for spinal flexibility. The spine's natural curves, cervical and lumbar lordosis, and thoracic and sacral kyphosis, are crucial for distributing weight and maintaining balance. These curves provide strength and resilience, protecting the delicate spinal cord housed within the vertebral column. Understanding the intricate arrangement of bones, ligaments, and muscles is fundamental to chiropractic practice. Proper alignment of these structures is essential for optimal nervous system function and overall health. Any deviation from this alignment can potentially impact nerve pathways, leading to various health issues. The nervous system, comprising the brain, spinal cord, and peripheral nerves, is the master control system of the body. The spinal cord, protected by the vertebral column, acts as a superhighway for nerve impulses traveling between the brain and the rest of the body. Spinal nerves branch out from the cord at each vertebral level, innervating muscles, organs, and tissues. Interference with these nerve pathways, often due to spinal misalignment or subluxation, can disrupt communication and impair bodily functions. Chiropractors aim to restore proper spinal alignment to alleviate pressure on nerves, thereby enhancing the nervous system's ability to transmit vital information. This restoration of nerve flow is central to the chiropractic approach to health and healing. Biomechanics of the musculoskeletal system. Biomechanics is the study of mechanical laws relating to the movement or structure of living organisms. In chiropractic, it focuses on how forces affect the musculoskeletal system, particularly the spine and its associated joints. Understanding spinal biomechanics involves analyzing the forces acting on vertebrae, discs, ligaments, and muscles during movement and at rest. Proper spinal alignment ensures optimal distribution of these forces, minimizing stress and wear on tissues. When biomechanical imbalances occur, such as through poor posture, injury, or repetitive strain, they can lead to joint dysfunction, pain, and nerve interference. Chiropractors assess these biomechanical patterns to identify areas of dysfunction. This analysis helps in developing targeted treatment plans to restore normal joint mechanics and reduce pain. It is a critical aspect of diagnosing and treating musculoskeletal conditions effectively. Joint kinematics, the study of joint motion, and kinetics, the study of forces causing motion, are integral to chiropractic biomechanics. Each spinal segment has a specific range of motion, and restrictions in this motion can indicate a subluxation. The concept of the joint play or end feel helps chiropractors assess the quality of joint movement. Understanding how muscles, ligaments, and fascia interact to stabilize and move the spine is also crucial. For instance, muscle imbalances can pull vertebrae out of alignment, while ligamentous laxity can lead to instability. By applying biomechanical principles, chiropractors can identify the root cause of musculoskeletal problems. This allows for precise adjustments and rehabilitative exercises to restore optimal function and prevent recurrence of symptoms. Principles of spinal subluxation. Spinal subluxation is a core concept in chiropractic, referring to a misalignment or dysfunction of a vertebral segment that can interfere with nerve function. While not a full dislocation, a subluxation involves subtle changes in spinal mechanics or position. These changes can irritate or compress spinal nerves, leading to a range of symptoms beyond localized pain. The vertebral subluxation complex, VSC, is a broader term encompassing the neurological, muscular, vascular, and connective tissue changes associated with subluxation. It is understood as a complex of functional, structural, and pathological articular changes that compromise neural integrity. Identifying and correcting these subluxations is the primary focus of chiropractic adjustments. This concept underpins much of the diagnostic and therapeutic approach in chiropractic care, guiding practitioners in their assessment and treatment strategies. The components of the vertebral subluxation complex include kinesiopathology, neuropathophysiology, myopathology, histopathology, and pathophysiology. Kinesiopathology refers to abnormal motion or position of the vertebrae. Neuropathophysiology describes nerve irritation or compression. Myopathology involves muscle spasm or weakness. Histopathology covers cellular changes, such as inflammation. Pathophysiology relates to the overall systemic effects of these changes on the body. Understanding these components allows chiropractors to comprehensively assess the impact of subluxation on a patient's health. The goal of chiropractic care is to address these various components through specific adjustments, restoring proper spinal function and reducing nerve interference. This holistic view helps in managing complex patient presentations effectively. Chiropractic assessment, history taking. A thorough patient history is the cornerstone of any effective chiropractic assessment. It involves gathering detailed information about the patient's chief complaint, present illness, past medical history, family history, and social history. The chiropractor asks specific questions about the onset, duration, location, character, and severity of pain or symptoms. Understanding aggravating and alleviating factors, as well as any associated symptoms, helps in forming a preliminary diagnosis. Information about previous injuries, surgeries, medications, and lifestyle habits provides crucial context. This comprehensive approach allows the chiropractor to develop a holistic picture of the patient's health status. It also helps in identifying potential contraindications to chiropractic care and determining the most appropriate course of action. A well-taken history guides the subsequent physical examination. Beyond the physical symptoms, a chiropractor also explores the patient's goals for care, their understanding of their condition, and their expectations from treatment. This includes inquiring about their daily activities, work environment, hobbies, and stress levels, as these factors can significantly impact musculoskeletal health. Asking about sleep patterns, dietary habits, and exercise routines further contributes to a complete health profile. The chiropractor also assesses the patient's psychological state, as stress and emotional factors can influence pain perception and recovery. Building rapport and trust during this initial conversation is vital for a successful therapeutic relationship. Effective history-taking is an art that combines active listening with targeted questioning, ensuring all relevant information is collected for accurate diagnosis and personalized care. Chiropractic assessment. Physical examination. Following a thorough history, a comprehensive physical examination is performed to objectively assess the patient's musculoskeletal and neurological systems. This examination typically includes observation, palpation, range of motion testing, orthopedic tests, and neurological assessments. Observation involves visually inspecting posture, gait, and any visible asymmetries or abnormalities. Palpation, using the hands, helps identify areas of tenderness, muscle spasm, swelling, or joint dysfunction. Range of motion tests measure the flexibility and mobility of various joints, particularly in the spine. These initial steps provide crucial objective data that complements the subjective information gathered during history taking. The chiropractor systematically evaluates the affected areas, looking for specific indicators of subluxation or other musculoskeletal conditions. This detailed physical assessment is vital for accurate diagnosis and effective treatment planning. Orthopedic tests are specific maneuvers designed to provoke or alleviate symptoms, helping to identify the source of pain or dysfunction. Examples include straight leg raise tests for sciatica or various shoulder impingement tests. Neurological assessments evaluate nerve function, including reflexes, muscle strength, and sensory perception. These tests help determine if nerve compression or damage is present and its severity. Postural analysis, both static and dynamic, provides insights into chronic stress patterns on the spine and joints. The chiropractor integrates all these findings to form a working diagnosis and to rule out serious pathologies that may require referral to another healthcare provider. This meticulous examination process ensures that chiropractic care is safe, appropriate, and tailored to the individual needs of each patient, forming the basis for a targeted treatment plan. Diagnostic imaging in chiropractic. Diagnostic imaging plays a supportive role in chiropractic care, providing valuable insights into the structural integrity of the spine and musculoskeletal system. While not always necessary, X-rays are commonly used to visualize bone structure, identify spinal misalignments, detect congenital anomalies, and rule out serious pathologies like fractures, tumors, or advanced degenerative changes. They help chiropractors assess the condition of intervertebral discs indirectly by observing disc space height. X-rays also provide a baseline for monitoring progress over time, especially in cases involving scoliosis or significant postural deviations. The decision to use imaging is based on clinical necessity, guided by patient history and physical examination findings. It is an important tool for ensuring patient safety and tailoring treatment plans effectively. Beyond X-rays, other imaging modalities such as MRI, magnetic resonance imaging, and CT, computed tomography, scans may be utilized in specific cases. MRI provides detailed images of soft tissues, including intervertebral discs, ligaments, muscles, and nerves, making it invaluable for diagnosing disc herniations, nerve impingement, or spinal cord lesions. CT scans offer cross-sectional images that are excellent for visualizing complex bone structures and detecting subtle fractures. These advanced imaging techniques are typically reserved for cases where more detailed information is required, such as persistent neurological symptoms, suspected serious pathology, or when considering surgical referral. Chiropractors interpret these images in conjunction with clinical findings to formulate a comprehensive diagnosis and treatment strategy, ensuring the most appropriate care for their patients. Chiropractic adjusting techniques. Diversified. The diversified technique is the most widely practiced chiropractic adjusting technique, characterized by its hands-on, high-velocity, low-amplitude HVLA thrusts. This technique aims to restore proper joint motion and alignment, particularly in the spine. Chiropractors use their hands to apply a quick, precise force to a specific vertebra, often resulting in an audible pop or cavitation sound. This sound is caused by the release of gas within the joint fluid, not by bones rubbing together. The diversified technique is adaptable and can be applied to various joints throughout the body, not just the spine. It is a highly effective method for addressing spinal subluxations and improving nervous system function. The technique requires significant skill and precision, developed through extensive training and practice. During a diversified adjustment, the patient is typically positioned on a specialized chiropractic table, which may have drop sections to assist with the adjustment. The chiropractor uses specific contact points on the patient's body and applies a controlled thrust in a precise direction. The goal is to restore normal range of motion, reduce nerve irritation, and alleviate pain. This technique is often chosen for its directness and efficacy in correcting joint dysfunction. While the audible cavitation is common, its absence does not necessarily mean the adjustment was unsuccessful. The primary objective is the restoration of joint mobility and neurological function. Diversified technique is a cornerstone of chiropractic practice, forming the basis for many other adjusting methods. Chiropractic adjusting techniques. Gonstead. The Gonstead technique is a highly specific and systematic approach to chiropractic adjusting, developed by Dr. Clarence Gonstead. It emphasizes a thorough analysis to identify the exact location of a subluxation, the direction of misalignment, and the most appropriate adjustment. This technique utilizes a 5-step analysis: visualization, palpation, instrumentation, nervoscope or temposcope, static palpation, and motion palpation, and full spine X-rays. The goal is to deliver a precise, low-force adjustment to only the affected segment, avoiding unnecessary manipulation of other areas. Gonstead practitioners believe that only the segment that is out of place and causing nerve interference should be adjusted. This specificity is a hallmark of the Gonstead system, aiming for maximum effectiveness with minimal intervention. During a Gonstead adjustment, patients are often positioned in unique ways on a specialized Gonstead adjusting table, which has various drop sections and supports. The chiropractor uses specific contacts, often with a pisiform contact, to deliver a very precise and controlled thrust. The focus is on restoring proper disc-nerve relationship and optimizing nervous system function. The detailed analysis ensures that the adjustment is tailored to the individual patient's unique spinal mechanics. This technique is known for its meticulous diagnostic process and highly specific adjustments. It requires extensive training and a deep understanding of spinal biomechanics to master. The Gonstead approach is revered by many for its scientific rigor and consistent clinical results, making it a distinct and powerful chiropractic method. Chiropractic adjusting techniques. Activator. The activator method's chiropractic technique, AMCT, utilizes a small, handheld, spring-loaded instrument called the activator adjusting instrument to deliver a gentle, low-force impulse to the spine. This technique is an alternative to traditional manual adjustments, particularly suitable for patients who prefer a lighter touch or have conditions that contraindicate high-velocity thrusts. The activator instrument delivers a very fast, controlled force, which is believed to be faster than the body's natural muscle resistance, allowing for effective adjustment without significant patient discomfort. This method is often chosen for its precision and gentleness, making it ideal for a wide range of patients, including children, the elderly, and those with acute pain or specific medical conditions. It represents a different philosophy of force application in chiropractic. The activator technique involves a systematic protocol for identifying subluxations, often using leg length analysis and muscle testing. The chiropractor observes how the patient's body responds to specific challenges or movements to pinpoint areas of dysfunction. Once a subluxation is identified, the activator instrument is used to deliver a targeted impulse to the affected joint. The low force and high speed of the adjustment aim to restore joint motion and reduce nerve interference without causing undue stress. Post-adjustment, the chiropractor re-evaluates the patient's responses to confirm the effectiveness of the treatment. This technique is evidence-based and has undergone extensive research to validate its efficacy. Its gentle nature and systematic approach make it a popular choice for both practitioners and patients seeking a precise and comfortable chiropractic experience. Other adjusting methods and modalities beyond the major techniques like diversified, Gonstead, and activator, chiropractors utilize a wide array of other adjusting methods and therapeutic modalities to address diverse patient needs. Techniques like sacro-occipital technique, SOT, focus on the relationship between the sacrum and occiput using gentle blocking and cranial adjustments. Applied kinesiology, AK, incorporates muscle testing to diagnose and treat structural, chemical, and mental imbalances. Thompson terminal point technique, often called drop table technique, uses a specialized table with drop sections to assist with the adjustment, allowing for lower force application. Each technique offers a unique approach to restoring spinal and joint function, providing chiropractors with a versatile toolkit. The choice of technique depends on the patient's condition, preference, and the chiropractor's expertise. In addition to manual adjustments, chiropractors often incorporate various therapeutic modalities to complement their care. These may include soft tissue therapies like massage, myofascial release, or trigger point therapy to address muscle tension and adhesions. Physiotherapeutic modalities such as ultrasound, electrical stimulation, and cold laser therapy can help reduce pain, inflammation, and promote tissue healing. Rehabilitative exercises and stretches are frequently prescribed to strengthen weak muscles, improve flexibility, and stabilize the spine. Nutritional counseling and lifestyle advice also play a significant role in supporting overall health and recovery. The integration of these diverse methods allows for a comprehensive and individualized treatment plan, addressing both the structural and functional aspects of a patient's health, leading to more effective and lasting results. Patient care and management strategies. Effective patient care in chiropractic extends beyond the adjustment itself, encompassing a holistic approach to management. This begins with establishing clear communication and building a strong doctor-patient relationship based on trust and mutual respect. Developing a personalized care plan involves setting realistic goals, explaining the treatment process, and discussing expected outcomes. Patient education is paramount, empowering individuals with knowledge about their condition, posture, ergonomics, and self-care strategies. Regular reassessments are crucial to monitor progress, make necessary adjustments to the care plan, and ensure the patient is responding positively to treatment. Its ongoing dialogue and evaluation ensure that care remains patient-centered and effective, adapting to evolving needs. A well-managed patient journey contributes significantly to positive health outcomes and patient satisfaction. Managing patient expectations is a critical aspect of care, especially regarding the timeline for recovery and the role of chiropractic in overall wellness. Chiropractors often utilize a phased approach to care, starting with acute relief, progressing to corrective care, and finally, focusing on wellness or maintenance care. This structured approach helps patients understand the journey and commit to long-term health. Referral to other healthcare professionals is made when a condition falls outside the scope of chiropractic practice or requires co-management. This interprofessional collaboration ensures the patient receives the most comprehensive care possible. Documenting all aspects of care, from initial assessment to treatment and progress notes, is essential for legal, ethical, and clinical reasons. Comprehensive patient management is key to successful outcomes and building a thriving practice. Rehabilitation and exercise prescription. Rehabilitation and exercise prescription are integral components of comprehensive chiropractic care, aimed at restoring function, strengthening weakened muscles, and preventing recurrence of injuries. After addressing spinal or joint dysfunction with adjustments, chiropractors guide patients through targeted exercises to stabilize the corrected areas. These exercises often focus on core strength, flexibility, balance, and proprioception. Examples include specific stretches for tight muscles, strengthening exercises for postural muscles, and balance drills. The goal is not just to alleviate pain, but to improve overall physical capacity and resilience. A personalized exercise program is developed based on the patient's specific condition, fitness level, and lifestyle. This proactive approach empowers patients to take an active role in their recovery and long-term health. The progression of rehabilitative exercises is carefully monitored and adjusted as the patient improves. Initially, exercises may be gentle and focus on restoring basic movement patterns. As strength and stability increase, the program advances to more challenging exercises. Chiropractors educate patients on proper form and technique to ensure safety and maximize effectiveness. Home exercise programs are frequently prescribed, allowing patients to continue their rehabilitation outside the clinic setting. This continuity of care is vital for reinforcing the benefits of adjustments and building lasting strength. Integrating rehabilitation into chiropractic treatment helps to correct underlying biomechanical imbalances, reduce the likelihood of future injuries, and enhance overall physical well-being. It transforms passive treatment into an active partnership for health. Nutrition and lifestyle counseling. Nutrition and lifestyle counseling are essential components of a holistic chiropractic approach, recognizing that overall health significantly impacts musculoskeletal well-being. Chiropractors often provide guidance on dietary choices to reduce inflammation, support tissue repair, and maintain a healthy weight. Advice may include increasing intake of anti-inflammatory foods, ensuring adequate hydration, and supplementing with essential nutrients when necessary. Understanding the link between diet and conditions like chronic pain or arthritis empowers patients to make informed choices. This counseling is not about prescribing strict diets, but about educating patients on how nutrition can support their body's healing processes. It emphasizes a balanced and sustainable approach to eating, promoting long-term health benefits. The goal is to optimize the internal environment for healing and wellness. Beyond nutrition, lifestyle counseling addresses other factors influencing health, such as stress management, sleep hygiene, and ergonomic considerations. Chiropractors educate patients on techniques to manage stress, which can manifest as muscle tension and pain. Recommendations for improving sleep quality are crucial, as restorative sleep is vital for healing and recovery. Ergonomic advice, the work and home environments, helps prevent repetitive strain injuries and maintain proper posture. Encouraging regular physical activity tailored to the individual's capabilities is also a key aspect of lifestyle counseling. By addressing these broader lifestyle factors, chiropractors help patients create a supportive environment for their health. This comprehensive approach ensures that patients have the tools to maintain their well-being beyond the clinic, fostering a truly holistic path to health. Special populations, pediatrics. Chiropractic care for pediatric patients requires a specialized approach, recognizing the unique developmental stages and anatomical differences in infants, children, and adolescents. Adjustments for children are typically very gentle, using minimal force, often no more than the pressure used to test a ripe tomato. Common reasons parents seek chiropractic care for their children include issues related to birth trauma, feeding difficulties, colic, ear infections, and developmental delays. As children grow, chiropractic can help with postural issues, sports injuries, and general wellness. The focus is on supporting healthy growth and development, ensuring proper spinal alignment and nervous system function from an early age. Early intervention can often prevent minor issues from becoming more significant problems later in life. The assessment of pediatric patients involves age-appropriate techniques, including careful observation of movement patterns, gentle palpation, and specific orthopedic tests adapted for children. Communication with both the child and parents is crucial to ensure comfort and cooperation. Treatment plans are tailored to the child's specific needs, often involving fewer and gentler adjustments than those for adults. Chiropractors also provide guidance to parents on topics such as proper carrying techniques for infants, ergonomic considerations for school-aged children, and nutritional support for growing bodies. The goal is to optimize the child's innate healing ability and support their overall health and development, allowing them to thrive. Pediatric chiropractic care emphasizes a preventative and wellness-oriented approach. Special populations, geriatrics. Chiropractic care for geriatric patients requires careful consideration of age-related physiological changes, such as decreased bone density, reduced joint flexibility, and degenerative conditions like osteoarthritis. Adjustments for older adults are typically modified to be very gentle, low force, and adapted to individual health status. The primary goals of chiropractic care in this population include reducing pain, improving mobility, enhancing balance to prevent falls, and maintaining overall quality of life. Common conditions addressed include chronic back pain, neck stiffness, headaches, and joint pain. Chiropractors work to restore function and alleviate discomfort, allowing seniors to remain active and independent. The approach is always conservative and tailored to ensure safety and effectiveness for fragile or compromised systems. A comprehensive assessment for geriatric patients includes a thorough review of medical history, medications, and any pre-existing conditions. Special attention is paid to bone density, neurological function, and balance. The physical examination involves gentle palpation, modified range of motion tests, and functional assessments. Treatment plans often incorporate a combination of gentle adjustments, soft tissue therapies, and specific exercises designed to improve strength, flexibility, and balance. Nutritional advice, particularly regarding bone health, may also be provided. Interprofessional collaboration with other healthcare providers is common to ensure integrated care. The focus is on enhancing the senior's ability to perform daily activities and enjoy a higher quality of life, emphasizing comfort, safety, and functional improvement. Special populations. Pregnancy. Chiropractic care during pregnancy offers a safe and effective way to manage musculoskeletal discomforts and support the body's changes. As the body adapts to accommodate a growing fetus, women often experience increased lumbar lordosis, pelvic instability, and changes in gait, leading to back pain, sciatica, and pubic symphysis dysfunction. Chiropractors use specialized techniques and adjusting tables to ensure comfort and safety for both the mother and baby. The Wedster technique, in particular, is a specific chiropractic analysis and adjustment that aims to reduce sacral subluxation and improve neurobiomechanical function in the pelvis. This technique is often used to optimize pelvic alignment, which can facilitate a smoother labor and delivery. The goal is to alleviate pain, improve pelvic balance, and support the body's natural birthing process. A thorough assessment for pregnant patients includes a detailed history of the pregnancy, any complications, and specific areas of discomfort. The physical examination is adapted to the pregnant body, focusing on gentle palpation, modified orthopedic tests, and careful assessment of pelvic alignment. Adjustments are always gentle and non-invasive, with the patient positioned comfortably on specialized tables that allow for abdominal space. Chiropractors also provide advice on posture, exercise, nutrition, and birth preparation. The benefits extend beyond pain relief. potentially reducing labor time and decreasing the need for medical interventions. Chiropractic care during pregnancy is a holistic approach to supporting maternal well-being and preparing the body for childbirth, ensuring a healthier experience for both mother and baby. It is a vital part of a comprehensive prenatal care plan. Ethics and professionalism in chiropractic. Ethics and professionalism are paramount in chiropractic practice, guiding practitioners in their interactions with patients, colleagues, and the public. Chiropractors are bound by a strict code of ethics that emphasizes patient welfare, informed consent, confidentiality, and integrity. Maintaining professional boundaries, avoiding conflicts of interest, and practicing within one's scope of competence are fundamental responsibilities. Upholding the highest standards of care ensures patient safety and builds trust in the profession. Continuous professional development, including ongoing education and adherence to regulatory guidelines, is essential for maintaining competence and staying abreast of advancements in chiropractic science. Ethical conduct is not merely about avoiding wrongdoing, but actively promoting the well-being and best interests of every patient. It forms the bedrock of a reputable and trustworthy healthcare practice. Professionalism encompasses not only ethical conduct, but also appearance, communication, and demeanor. Chiropractors are expected to present themselves in a professional manner, both in their personal conduct and in the clinical setting. Clear, empathetic, and respectful communication with patients is crucial for building rapport and ensuring understanding. This includes explaining diagnoses, treatment plans, and potential risks in an accessible way. Collaboration with other healthcare providers, when appropriate, demonstrates a commitment to comprehensive patient care and interprofessional respect. Adherence to legal and regulatory frameworks governing chiropractic practice is non-negotiable. By embodying professionalism, chiropractors contribute to the positive image and credibility of their profession, fostering public confidence and ensuring high-quality healthcare delivery. It is a continuous commitment to excellence in all aspects of practice. Legal aspects of chiropractic practice. Chiropractic practice is governed by a complex framework of legal regulations and statutes designed to protect the public and ensure competent care. These laws vary significantly by jurisdiction, typically covering licensure requirements, scope of practice, advertising guidelines, and patient record keeping. Chiropractors must obtain and maintain a valid license to practice, which often involves specific educational requirements, national board examinations, and continuing education. Understanding and adhering to the defined scope of practice is crucial to avoid legal repercussions. This outlines what procedures and treatments a chiropractor is legally permitted to perform. Ignorance of these laws is not a defense, making diligent awareness essential for every practitioner. Compliance with these legal aspects ensures that chiropractors operate within established professional boundaries and uphold public trust. Malpractice liability is a significant legal consideration for chiropractors, requiring comprehensive professional liability insurance. This insurance protects practitioners against claims of negligence or harm resulting from their professional services. Patient consent, particularly informed consent, is another critical legal and ethical requirement. Chiropractors must clearly explain proposed treatments, potential risks, benefits, and alternative options to patients, obtaining their voluntary agreement before proceeding. Accurate and thorough documentation of all patient encounters, including history, examination findings, treatment plans, and progress notes, is vital for legal defense and continuity of care. Adherence to privacy laws, such as HIPAA in the United States, is also mandatory to protect patient health information. Navigating these legal aspects effectively is fundamental to a safe, ethical, and sustainable chiropractic practice, safeguarding both the practitioner and the patient. Practice management and business skills. Successful chiropractic practice requires more than clinical expertise. It demands strong practice management and business skills. This includes developing a comprehensive business plan, managing finances, marketing services, and effectively handling administrative tasks. Creating a clear vision and mission for the practice is crucial for guiding decisions and attracting the right patient base. Financial management involves budgeting, billing, insurance processing, and managing accounts receivable to ensure the practice's economic viability. Understanding the nuances of healthcare billing codes and insurance reimbursement is essential for financial stability. Effective practice management ensures smooth operations, allowing chiropractors to focus on patient care without being overwhelmed by administrative burdens. It is the backbone of a sustainable and thriving chiropractic business. Marketing and patient acquisition strategies are vital for building and growing a practice. This includes developing a professional brand, utilizing digital marketing, website, social media without text, community outreach, and patient referral programs. Excellent patient experience, from the initial phone call to follow-up care, is the best marketing tool. Staff management, including hiring, training, and retaining skilled personnel, is another critical aspect. Efficient scheduling, patient flow optimization, and maintaining accurate records contribute to operational excellence. Investing in technology, such as electronic health records, EHR systems, no text visible, can streamline operations and improve efficiency. Mastering these business skills empowers chiropractors to build a successful and fulfilling career, providing high-quality care while ensuring the long-term sustainability of their practice. It transforms a passion for healing into a viable profession. Interprofessional collaboration. Interprofessional collaboration is increasingly recognized as vital for providing comprehensive and patient-centered healthcare. Chiropractors frequently collaborate with other healthcare professionals, including medical doctors, physical therapists, massage therapists, and specialists like neurologists or orthopedic surgeons. This collaboration involves open communication, shared decision-making, and coordinated care plans to achieve the best outcomes for the patient. For instance, a chiropractor might refer a patient to a medical doctor for medication management or diagnostic tests outside their scope, or to a physical therapist for specialized rehabilitation. Conversely, other professionals may refer patients to chiropractors for musculoskeletal issues. This team-based approach ensures that all aspects of a patient's health are addressed. Leveraging the unique expertise of each discipline, it moves beyond isolated care to integrated solutions. Effective interprofessional collaboration requires mutual respect, clear understanding of each profession's scope of practice, and a commitment to shared patient goals. Regular communication, whether through formal meetings, shared electronic health records without text, or direct consultations, facilitates seamless care transitions. This collaborative model benefits patients by providing a more holistic and coordinated approach to their health challenges, often leading to better outcomes and higher satisfaction. It also enhances the professional development of practitioners by fostering learning and broadening perspectives. By actively engaging in interprofessional collaboration, chiropractors contribute to a more integrated healthcare system, breaking down traditional silos and promoting a patient-first philosophy. This cooperative spirit is essential for navigating complex health conditions and ensuring optimal patient well-being in today's healthcare landscape. Research and evidence-based practice. Research and evidence-based practice, EBP, are fundamental for the advancement and credibility of chiropractic therapy. EBP involves integrating the best available research evidence with clinical expertise and patient values to make informed healthcare decisions. Chiropractors are increasingly engaging in and utilizing research to validate the efficacy of their treatments, understand underlying mechanisms, and improve patient outcomes. This includes studies on spinal manipulation for various conditions, the neurophysiological effects of adjustments, and the cost-effectiveness of chiropractic care. Staying current with scientific literature is a professional responsibility, ensuring that practice methods are supported by robust evidence. A commitment to research helps to refine techniques, develop new approaches, and strengthen the chiropractic profession's standing within the broader healthcare community. It moves the practice forward from anecdotal experience to scientifically validated care. Implementing evidence-based practice requires critical appraisal skills to evaluate the quality and applicability of research findings. Chiropractors must be able to interpret scientific studies, understand statistical significance, and discern reliable evidence from less rigorous data. This continuous learning process ensures that clinical decisions are informed by the most current and relevant scientific knowledge. Patient values and preferences also play a crucial role in EBP, as treatment plans must be tailored to individual needs and beliefs. By combining scientific evidence with clinical experience and patient input, chiropractors can provide the highest standard of care. This dedication to EBP not only enhances patient safety and effectiveness, but also contributes to the ongoing scientific development and recognition of chiropractic as a respected healthcare profession. It fosters a culture of continuous improvement and accountability. Public health and wellness promotion. Chiropractors play a significant role in public health and wellness promotion, extending their impact beyond individual patient care to community-level initiatives. This involves educating the public about the importance of spinal health, good posture, regular exercise, and healthy lifestyle choices. Participating in health fairs, workshops, and community events allows chiropractors to reach a broader audience and promote preventive care. They advocate for policies that support musculoskeletal health and overall well-being. By emphasizing proactive health management rather than just reactive treatment, chiropractors contribute to reducing the burden of chronic pain and musculoskeletal disorders in the population. This public health perspective aligns with the holistic philosophy of chiropractic, aiming to empower individuals and communities to achieve optimal health. It is about fostering a culture of wellness. Wellness promotion in chiropractic focuses on maintaining health and preventing disease before symptoms arise. This includes offering maintenance care, which involves periodic adjustments to sustain spinal health and nervous system function. Nutritional guidance, stress reduction techniques, and ergonomic advice are also integral to wellness programs. Chiropractors often serve as primary contact providers for musculoskeletal health, guiding patients towards healthier habits and empowering them to take responsibility for their well-being. By integrating wellness principles into their practice, chiropractors help individuals build resilience and improve their overall quality of life. This proactive approach not only benefits individuals, but also contributes to a healthier, more productive society, reducing healthcare costs and improving public well-being. It is a commitment to a healthier future for all. Advanced topics in chiropractic. Advanced topics in chiropractic therapy delve into specialized areas that build upon foundational knowledge, offering practitioners opportunities for further specialization and enhanced patient care. These areas might include sports chiropractic, focusing on injury prevention, performance enhancement, and rapid recovery for athletes. Pediatric and geriatric chiropractic, as previously discussed, are also advanced specializations requiring additional training. Other areas include chiropractic neurology, which explores the intricate relationship between the nervous system and spinal function, often involving advanced diagnostic and rehabilitative techniques. Functional medicine, integrating nutrition and lifestyle interventions for chronic conditions, is another growing area of interest. These advanced fields allow chiropractors to address complex patient presentations with greater precision and efficacy, expanding their scope of expertise. Advanced diagnostic tools and treatment modalities also fall under this category. This could involve advanced imaging interpretation, electromyography (EMG) for nerve and muscle function assessment, no text visible, or specialized instrument-assisted soft tissue mobilization techniques. Further education in areas like clinical nutrition, toxicology, or advanced rehabilitation protocols can significantly enhance a chiropractor's ability to manage complex cases. The pursuit of advanced certifications and diplomates demonstrates a commitment to lifelong learning and excellence in specific areas of practice. These specialized skills not only improve patient outcomes, but also allow chiropractors to serve a broader range of patient needs and collaborate more effectively with other healthcare specialists. It signifies a deeper level of mastery within the profession, pushing the boundaries of traditional chiropractic care. Future trends in chiropractic therapy. The future of chiropractic therapy is shaped by evolving research, technological advancements, and a growing emphasis on integrated healthcare. One significant trend is the increasing adoption of evidence-based practice, with more rigorous research validating chiropractic interventions. This will likely lead to greater acceptance and integration within mainstream healthcare systems. Technological innovations, such as advanced diagnostic imaging, AI-powered analysis of patient data, no text visible, and sophisticated adjusting instruments, will continue to enhance diagnostic accuracy and treatment precision. Telehealth and remote patient monitoring are also emerging trends, allowing chiropractors to provide virtual consultations and support, especially for lifestyle and rehabilitative advice. These advancements promise to make chiropractic care more accessible, efficient, and personalized, adapting to the changing needs of patients. Another key trend is the continued expansion of chiropractic's role in wellness and preventive care, moving beyond just pain management. There will be a greater focus on lifestyle medicine, incorporating nutrition, exercise, stress management, and sleep hygiene as integral parts of chiropractic care. Interprofessional collaboration will strengthen, with chiropractors working more closely with medical doctors, physical therapists, and other specialists to provide truly holistic care. The profession is also likely to see further specialization, with more chiropractors focusing on specific populations like athletes, children, or those with chronic neurological conditions. As public demand for natural, non-invasive healthcare grows, chiropractic therapy is poised for continued growth and evolution, solidifying its position as a vital component of a comprehensive health and wellness strategy. It is a dynamic field, constantly adapting to new knowledge and patient needs.